Hi, and welcome everybody to this special edition round of Take 60 with the network. These typically 20-minute presentations are an opportunity for network members to engage virtually to learn from one another on how to build strategies, implement programs, and move our work forward. To get us started, I have just a few housekeeping items. This presentation is being recorded and will later be posted on Socius, our virtual community at www.oralhealth.network. If you aren't familiar with Socius, you should request a login and gain access to all open resources, policy alerts, and network-wide updates. So currently we have everybody muted or should have everybody muted, but at the end and throughout the presentation when presenters are calling for responses, you can unmute yourself to ask a question either by clicking on the microphone icon on your BlueJeans window, or if you're dialing in over the phone, press *4 to unmute yourself. You can also type any questions you have into the chat box, and we'll make sure that there's plenty of time for Q&A at the end. So today we'll be hearing from our communications and messaging work group from the National Oral Health Connection team, the NOCT. So Grace, if you want to advance to the next slide. So today we have Julie Duriger from Smart Beginnings Virginia Peninsula, Eileen Espejo from Children Now, Jan Grutzus from the Arizona Alliance for Community Health Centers, Grace Lynn and Francis Walsh were both on your network support team, and Mariana Yamamoto from Asian Americans Advancing Justice in Los Angeles. Next slide, please. Okay, so why a Take 60 today on the practical guide for open engagement, which you'll be hearing a lot about. We had a resource fair at our mid-year convenings that just took place in late May and early June. And we got a lot of feedback that people wanted a deeper dive into the resource, especially our representatives as they're going out and engaging others in the work that Open does. So we put together this Take 60 for everybody to be able to get a clearer understanding of what it is and how to use it. So for spreading the word and engaging others, this is all you need when describing Open to your personal or organizational networks at all levels of participation, whether people are just interested in downloading resources or jumping right in to a network response team working group. So everything you need is right here in this guide. And then if you want to go to the next slide, Grace. So before we dig in, we want to set the stage about why we need to have a network in the first place and engage others into our work. So now I'll pass it off to Grace, who will jump right in.
Thanks, Frances. So we thought, as we're talking through this new resource, this practical guide today, we wanted to encourage everybody to think about networks in general and Open in particular. We're a network for good reason, because we're addressing a very complicated wicked problem in our systems. And when we can communicate together in aligned voices, we know we'll have better success in tackling the problems. And the guide is designed to help us with that common aligned messaging. And these are the components of a wicked problem. I think you all have probably seen this a few times. And I know there's a little delay here. So, okay. So because we're a network, we're in a unique position for tackling problems. Because of our deep connections and our collective coordinated effort and our resources, we've got a lot of resources that we can share. We know that we can be successful when we collaborate in collective coordinated effort. And we're calling your attention to the guide today because it can help engage others in our work. And as you think about those others, we're challenging you to be creative in your thinking. It's not always the typical or usual suspects but those working in other systems that also have interest in social issues, health equity, and community improvement. And our purpose as a network is to, as the Oral Health Progress and Equity Network, is to catalyze a network to take on America's oral health challenges. Everyone has an equitable chance to thrive. I wanted to give a quick nod to the 20-wide project because it really is a perfect opportunity for using the resources in the practical guide. Reaching out to stakeholders at the periphery of our network strengthens and grows open. And you can find this great step-by-step guide to the project on Socius. And I'm going to pass this off now to Julie, who's going to tell us or talk a little bit more about what we mean when we talk about these stakeholders.
So I'm going to start just by reading the quote, and it's a wonderful image that's on the slide. So if you take a tent and you stake it out far at the margins, far out at the margins, the middle is always covered, and the further out you stake it, the stronger the structure you get. And why is that? Because in our systems and in our social systems, the people at the margins are actually living with the failures of the systems, and they are creating adaptive solutions to them. So when we design to take care of them, we'll build stronger systems for everyone. And I think the quote really captures why we have this practical guide in the first place, because as a network, we need to make sure that we're reaching out and sharing our stories so we can engage in creating the solutions to the systemic problems we're facing. And the part about when we design to take care of them also makes me think about another quote, nothing about us without us. And as open advocates, it's really part of our job to do that work. Next slide. So just to make sure we're all on the same page, this is how we in Open are defining what a stakeholder is. A stakeholder is any organization, group, or individual who has an interest or concern in an organization, in this case Open, and its work. Stakeholders may affect or be affected by Open's goals, objectives, actions, or policies. So Mariana and I will talk a bit more later when we're talking about who these audiences are and our outreach, but we need to make sure we always consider the perspectives of those different groups in order for our engagement efforts to be successful. Now that we're clear on our definition of stakeholder, Francis is going to walk us through how we'll locate current stakeholders on Socius.
Okay, so once you are logged into Socius at www.oralhealth.network, anywhere on the entire site, you can locate anything to do with Open membership from the navigation bar. So your navigation bar will have a tab called Members. So when you click Members or even hover over it, you'll see those options. So you can get into the member guide, which is an always ever-changing document as we upgrade and move on. You can update your profile, and then you can also search for other members who have a profile on Socius. So if you click on that, you'll be able to type in, names, organizations, or even states. So you can take a look at the Socius members on your state that way. And then you're also able to view the network directory for all of our Knocked and Rocked, Nest, and I believe GLOW is also on there, the grassroots lead organizations. So that's an open representative directory. And then also our virtual roadmap, which plots all the different programs and initiatives that are going on across the country. So if you move on to the next slide. You can also take a look at the virtual roadmap and the network directory. Anytime that you click home and you're on that home screen, you'll be able to access either way. So either under the members tab or click home, and then there's the buttons, virtual roadmap and network directory. So make sure to play around with that on your own, when you're on your own time. I wish I had time for a live demo right now, but Grace, if you can move on to the next slide. Okay, so now that you're able to find others working in open already, let's look more closely at the tools and resources that are contained in the practical guide for open engagement. You're able to find that by clicking on the About Us tab, and then Practical Guide for Open Engagement right under there. Click that, and Mariana is now going to walk us through that detail.
Great. Now that we are armed with the context of open and why we're doing what we do and why it's critical for us to engage a broad variety of stakeholders, let's look at some of the actual pieces of the practical guide that are available for you to use. These materials were designed with outreach in mind, so you can use some of them or all of them depending on your audience and the stage of relationship that you're in with those individuals. If they don't know anything about open, you might want to review the welcome pitch, and it has a lot of great conversation starters about oral health that you could use with those individuals. If someone was ready to jump in and participate in open, you might leave them with an open business card that shares how new members can sign up for SOCIUS and prompts them to think about how they can be a change agent for oral health for all. You could also look at other materials like the core values or the destinations and see what materials or messages you would like to pull out as you're engaging these audiences. Next slide. And one more thing that we've heard from network members is that it's helpful to have a leave behind or that shares key information. These materials also have sound bites that you can lift and use in different communications like email messages, social media posts, or presentations. These one-pagers are a really great tool to use where you can link oral health to large issues that your audience cares about and what they're passionate about, like social justice and oral health. And definitely don't forget to talk about why you work on oral health too. And the last thing is that if someone is ready to dive in, the network guide is a great place for new members to orient themselves and navigate open. So once you click into SOCIUS and find the practical guide for open engagement, you can get your hands on these items. All you have to do is click on each of the icons or the links that are on SOCIUS, and you can download by either saving them or opening them on your computer so you can use them in your day-to-day work. So now we're going to give you some practical, real examples of how you might use this guide in the real world.
Great. So this is where we're starting to get into the practical application of this. We're going to start knocking on some doors. Grace, can you advance to the next slide, please? But first of all, go into this having fun. So here's a joke. So knock, knock, who's there? Doris. Doris who? Door is locked. That's why I'm knocking. Ha ha. Miss Grace, you're finding that joke. Next slide. So we wanted to, on this 360, present some scenarios and share with you all the different types of maybe presentations and engagement opportunities that you might have already run into or that you have run into or that you might run into and try to identify. So we all know that you may have both the in-person and virtual types of interactions with all sorts of stakeholders. And so we're going to share these scenarios that are based in real experience and some that, again, we think that you might anticipate as you're doing your outreach. As open ambassadors, we talk about open in a variety of situations. And now with these resources, we're going to be even better situated to make sure that these people are joining the network. So first, Jan is going to share some information about presenting to large audiences.
Hello. This is kind of a personal story wrapped into an example. And I'm just going to say there's a lot of feedback that I'm hearing. I don't know if the whole audience is hearing it, but beeping and all that. Okay, I will go on. I had the opportunity to present recently this summer to a very unusual and unexpected group. Still hearing the beeping. So you think about the expected audiences. You know, you might present something about oral health at your own organization or whatever, but the National Society of Actuaries had their national meeting here in Phoenix and contacted us to talk about value-based care and the safety net and how it's different from and the same as private practice. So it was, again, that unexpected, atypical group. But when you're going to present anywhere, again, think about how, you know, that particular group relates to you, what you're talking about, if it's about open or if it's about something else, and you're going to work open into it. So next slide. So I did some research about actuaries.
Jan, hang on one sec. Francis, can you make sure everybody's muted, please?
So
Thanks. Okay.
Okay, that's definitely better here. So no, it's still not. It's still here. I learned about actuaries and what they actually did and what some of the topics they were, you know, talking about. This was about health and health insurance, and so I really tried to work in open, not as a topic. I talked about our health centers and the safety net, but then I also said there's bigger mothership, so to speak, called open, and a little bit about it just at the end. So you kind of customize it with, you know, what you have. What you have is kind of a call to action. So, you know, I go at it like, you know, everybody has teeth. Everybody knows that oral health is a problem, you know, as the actuaries, because it is that return on investment. So you just work it in. And I think, you know, one really good way to do that, and it kind of goes along with what others have been saying, if they're aware of the network, you know, you can use a one-pager that talks about the core values. If you've already done some investigation on your audience's core values or organization, you see where that'll match. You know, it's everybody likes short and easy, and everybody likes pictures, infographics. One-pagers are, I think, the way to go in most instances, especially for a short amount of time. You know, just carry the open business cards with you. It doesn't necessarily mean everyone in a large audience is going to want one, but you have them if you need them. Again, you know, it's about the why, and it's about just keeping open in the back of your mind for everything, because that's what this movement is going to take, everybody on board. So I think we're at a section when we're going to ask you to put some ideas in the chat box. You can go to the next slide. I think Francis is going to talk about anything
Yes.
that's been written in the chat so far?
So far, mostly just logistics, and we had a thumbs up to the tent analogy. And we like our stakeholder puns with the stakes in the tent as well. But so I just typed a message into the chat box on your Blue Jeans window. So wherever you see that speech bubble icon, if you kind of hover over Blue Jeans, you'll be able to see it. So that's the chat box. You can type in there if you have any examples of presenting to a large audience and whether or not you've presented about open so far, but thinking what kind of materials did you use or would you like to have to be able to use for any kind of large audience? Okay, so I have one response saying, I haven't presented, but it would be nice to share how open can benefit different groups that are engaged in this work. Um, Also, I think that's Tennessee Primary Care Association presents to one of the classes at the UT School of Dentistry. We presented last year and we'll see them again in October. We used a PowerPoint. Cool. So, and we do have, as we described, the PowerPoint that's contained within the guide, and you can customize that to whatever your presentation may be. And then a clarification from the first one, like specific benefits for different stakeholders. And we also, there is a document titled Member Benefits that you'll be able to find within that practical guide for open engagement once you're on Socius. So just start to look through the different items that are there, and we tried to make them as easy as possible to identify which ones are which and what you'll find in there. So are there any other comments? Okay, utilize some reasons that motivate the network to exist. Cool. So that also exists in there in a couple of places. This is exciting, guys, because everything is like, it's in there. Cool. Check. Um, okay, I hyperlink / embed the Socius homepage in my general PowerPoint slide deck to show what it looks like to register as a new user. It is really helpful for the visual. Oh, that's great. Way to go, Suzanne Martin. Okay, and then we got a big smiley face. Thanks for sharing. In September or October, I'm going to convene a Connecticut statewide oral health advocacy planning meeting with a broad base of stakeholders. I'm going to make sure to bring the materials for open and encourage key folks to get involved. I think it'll be a good way to engage more with folks who work oral health but not solely focused on it. That's awesome, Parisa. And then Judy Feinstein, I would echo Kaylee. Here in Maine, we want to present open and its resources to about 20 people who are already a network and use open to sort of ratchet things up. So that's great. And I would really encourage use of your state pages, in any way that you would like. It's completely customizable. We have guidance for how those of you that are state or grassroots representatives as administrators of those communities on Socius, you'll be able to customize anything from your image to adding calendar items for statewide meetings or whatever you would like. So if you need help finding that, get in touch with me and I'll be able to help you through that. What else? So Julie Seward, we will be hosting an American Indian Alaskan Native oral health data workshop open to stakeholders in Oklahoma. I will definitely have open resources available. It's wonderful. And Tammy Alexander, I use a PowerPoint slide and link to open on webinars to primary care associations when doing school-based health center and school oral health presentation. Hollis Rusinoff said, we haven't presented, but the campaign for dental health was included wording and links in our newsletter to 1,500 plus oral health stakeholders and will be doing so again. So that's awesome. And we also have sample language and tweets and a ton of things that you can customize as much as you want, but those are kind of out of the box ready from our communications working group as well. And I just want to shout out to this work group has been, for the last year at least, vetting all of our network materials, making sure they're on frame, making sure that they're open, branded, and ready to go. So all of those have gone and they're in the final design. And Grace Lynn just does such incredible work, as you can see by these slides. But I want you guys to have that in mind as you look through these tools, that these are all completely open ready. So, and thank you all for the great ideas, and we'll continue on our next scenario with Julie and Mariana.
Sorry, I was having some IT issues. So Jan gave a really specific example of the presentation that she did with the actuary group, but Mariana and I looked at the expanded stakeholder group as a whole. And we thought about what to call that group. Some people call it the outliers or the unusual suspects, but those are just the folks who aren't your usual audience, the ones who don't live and breathe oral health. So we have some audiences listed here on the slide: the business, education, community groups, civic groups, and faith. But we found that it really can just be anyone that you want to do a presentation to. And so it's any type of presentation. You can do a one-on-one, you can have a small group or make it a large group and virtual. And just the overall goal there is just to share the relevance of oral health to overall health, especially related to the work of their audience. And Jan mentioned it, and just to reemphasize that you just always need to have that lens of them not necessarily understanding how oral health connects to their work and help to make that connection for them. Next slide, please. So, on the previous slide, as I said, we listed some examples of that expanded stakeholder group. And you'll definitely need to spend a little time preparing for your presentation, obviously. And part of that is going to be defining who your audience is. Typically for that non-traditional expanded group, it just really seemed logical to us as a communications group to spend the majority of your time focusing on helping them see the connection between oral health and overall health, especially with regard to their work. There's lots of resources in the practical guide you can use to welcome the stakeholders to open, and as well as some steps that you can take with them for engagement. Mariana is now going to talk us through a few of those specific resources.
Great, thanks, Julie. And you'll see that a big theme in our presentation is that it's really important to prepare for your outreach or your presentation and learn what the person or group or organization that you're reaching out to, learn about what they do, what they're passionate about, what their focus area is. And I think at least one thing I've learned since joining the network is the vast reach of oral health and how it relates to so many areas and all aspects of our lives. So definitely take your time and build relationships with your audience and make those connections first, because it'll really set the foundation for the rest of your conversation. And two of the resources that for folks who might not be already engaged in oral health that might be helpful for you to turn to is, the first one is the oral health link to social justice, and the second one is linking oral health to overall health. You can definitely use these one-pagers to pull talking points and messages so that you can draw these links between oral health and whatever the area of work of your audience is. And you can also leave them behind with your audience too, so that they can review and learn more about oral health and how it links up with their work. But I think they're a great place to start your conversation. Next slide. There are also some really great additional resources available in this practical guide. Once you've built that relationship with your audience, you can then start talking about open and the network and what we do. So, for example, the member benefits, you can read about what open members, current members, have to say about the network, what they like, what drew them in, etc. You can use the Welcoming Stakeholders to Open guide to start a conversation with an interested stakeholder. It provides some great conversation starters and some ways to frame oral health as you talk to folks. You can turn to the core value statement so that you can share what open stands for and why we do this work and what is our driving compass as we work on these. And all of these materials are really foundational, so you can use these in any scenario with any audience. Just make sure you build your relationship first. Next slide. So now we'll have a chance to hear from you once more. So
Okay, so
okay.
I put another question into the chat box. So thinking about expanded stakeholder groups, like which groups have you engaged with, or who could you engage with to describe the work of Open? What would you need to connect with them, or what have you used to connect with them? And any ideas that you have are all welcome in the chat box. While you guys are typing, or whomever may be typing, I want to share out from the last round. Lisa Staples said that she also hyperlinks and embeds the SOCIUS homepage in PowerPoints and has done so in a few presentations since the regional convening. Louisiana is also having Louisiana Oral Health Summit, and she plans to present on Open and will connect people to our state page. I just recently updated our state page and plan to share that out with the coalition. And so Noan is also presenting a session at NACHC's CHI annual conference this August. Okay. And then so for our expanded stakeholder groups, Tammy Alexander says, I will include open material, especially the oral health is critical to overall health and well-being in our back to school digest in late summer, early fall. Yesenia Silva says school districts and the behavioral health department. We've also got local early childhood organizations and teacher associations, also the public health department. Then we have dental students, nonprofit health advocacy organizations, legislators, state dental directors, all groups I've shared Open with. That's amazing. Also, these resources are foundational, and all of them can benefit, and all of us, I guess, can benefit from getting familiar with them. Also, another comment, I am working on a new teledentistry project and need to connect telehealth experts. We had an interesting situation arise where immigrants and asylees are feeling like they have no access to their traditional foods and are simultaneously locked out of the oral health system. I think it would be helpful to engage more with these folks. Are there resources for organizations working with asylees on SOCIUS? And I hope I'm saying that right. So we do have the network response team that is focused on immigrant justice. Formerly the public charge team, which one of our presenters, Mariana Yamamoto, had spearheaded. So yes, to that specific question, and we would love to connect the two of you offline. So that was Kaylee Hess, just so we make sure we make that connection. Okay. Another comment, we have included the Area Agency on Aging, the African American Health Group, the local health department. My community dental centers, early childhood agencies, and local hospitals, and large medical groups, as well as safety net services to share efforts to improve access and education to and about oral health. Nice, well said. Also, local state farm worker organizations. In North Carolina, we have Student Action with farm workers, and they have been a key partner for us. These are great. How are we on time? Should we continue on?
Time to move on.
Okay, so for our
Yeah.
final scenario, I'm gonna switch things over to Eileen Espejo.
Thanks, Frances. So here is the last scenario that we want to share with you all. This is inviting that key player or players that you know should be part of Open, but they just aren't yet. So I'm going to share a few examples of audiences that this might apply to, and the situation could be, you're sending an email to this group for the first time or person for the first time. You're about to have an in-person meeting with them. You're having a webinar, doing a webinar, or you're doing an actual presentation. And really the goal is to get a commitment from the stakeholder to participate more actively. So the first example of the three is your state dental director or your Medicaid dental director, or Medicaid dental director. So these are all the components from the practical guide that you can consider using either in like an introductory email, or if you happen to be at a meeting with them, just to say, hey, would love to follow up with you about this network that I'm a part of. We do this, that, and the other to really pull in the talking points from the oral health and overall health and improving systems, and to talk about the benefits of Open. So that's the first example. And I know some of your states are already doing this already, and you probably are doing this already, so I'd love to hear about that in the chat box. Another example for this scenario, and I'm not sure how many of you were there, but there was an open convening where representatives from the Poor People's Campaign came to talk to attendees about the work that they do. So there are local chapters all over the country. So a natural stakeholder would be for people to reach out to that local chapter of the Poor People's Campaign. You could refer to the welcome pitch for the language and framed messages. You could reach out to them with an email saying, hey, somebody from the Poor People's Campaign came to speak at this conference, and I wanted to follow up with you all and see if you could get involved with Open. Marianne already mentioned it, but there is that oral health and social justice one-pager. That's a really helpful frame to use when you're reaching out to them, and to use that as an opportunity to say, would love to meet with you in person or attend one of your meetings. Can we get on your agenda? All those things could apply to this scenario. And I would say, before we go to the next slide, and you've all kind of brought this up in your comments, this could include childhood obesity advocates that you might have been working with. It could include food nutrition groups that you might have been working with. So again, any opportunity that you have to connect with people that you might have had opportunities to connect with in the past, but it might not have been about oral health specifically, you can always go back to them. Okay, thanks, Grace. Next slide. So the last scenario, just because I work on children's oral health issues, the last scenario that came to my mind is, well, we need to have more early childhood centers such as preschools, Head Starts, et cetera, connected to Open, joining Open, and being part of the network. So that could be maybe your first initial touch is composing and sending an email to either a specific child care center, or maybe it's an association of child care centers, talking about Open with the core value statement and how oral health is linked to overall health, and again, requesting an opportunity to present to them at another meeting. And what's a relevant opportunity, what I just learned about, is the recent Maternal and Child Health Bureau, HRSA, and the U.S. Department of Health and Human Services had recently announced awards for the Networks for Oral Health Integration within the Maternal and Child Health Safety Net program. And so there are a number of states that got funding to actually work with and develop and implement a model of care that would promote the integration of optimal oral health services within a safety net setting, within community health centers. So you have, for example, we know that New York is going to be partnering with Maryland, Virginia, and Washington, D.C. to work specifically with infants and children up to age 2. So maybe there's an opportunity with grants that are starting to be awarded for these specific categories within oral health that we can be reaching out to say, hey, we heard you got this grant and would love for you to join Open if you haven't heard about it before. We know for another part of this grant, the Michigan Primary Care Association is partnering with Illinois, Iowa, and Ohio. We know that the Denver Health and Hospital Authority is partnering with Arizona, Montana, and Wyoming. These projects are all going to be starting in September 1st of this year, and they continue for up to 5 years. So this is an opportunity, I think, again, to see what's going on in your state and maybe try to partner with those organizations that might be getting funding that might not know about Open, but they're getting funding for oral health specifically. There was one other thing, but I think that was it. Okay. So in terms of preparation, again, you can use the intro slide deck that we've mentioned as part of the practical guide. You can use the welcome pitch. You can refer to the one-pagers on oral health and social justice and oral health and overall health, all these one-pagers that are already part of the practical guide. And just when you're thinking about that group that you know should be part of Open but just isn't yet, to really refer to those one-pagers and pick out the talking points and put that into your request to meet with them further or to make a presentation at one of their meetings. And then I would just mention that another idea could be to identify groups in your state or in your community that you know might be working on some of the Open goals that we've already talked about in previous meetings. But maybe there's a group out there, for example, that's working on data that you don't know if they're part of Open or not. So it could be even framing your pitch around, I know you work on data, I'm part of this national network that's looking at data, and then framing your pitch that way. And they might want to get in touch with you. I think I've covered everything for that third scenario. So Francis.
Cool, great job. Excellent scenarios and different ideas for open engagement. So now we've reached our open mic portion of today. And what inspiration do you have for using this practical guide for open engagement? Share any successes that you've had or ideas for stakeholders that you plan to contact. Anything that you can share with others, it's all open.
Yeah, so feel free to unmute yourself if you have something you'd like to speak into the airwaves.
And again, you can unmute by clicking on the microphone icon if you're on the Blue Jeans on your web browser. If you dialed in by phone, you can press *4 to unmute yourself. So we have from Suzanne Martin, our state in North Carolina, Office of Rural Health recently gave funds for local health clinics to create dental programs, and I've shared open resources and socials with the clinic directors. They were starved for oral health resources, so they were thrilled to learn about the network. So from Jan, as a state rep, I'm having a meeting with our grassroots organizations to discuss the Open Wide project and partnering with the state coalition. Okay. So what other ideas do you have or stories you can share on open engagement, and also if there are just any questions about today's presentation, where to find anything, who to reach out to, any questions you may have. You can also type those in or feel free to unmute yourself to ask.
This is Jan. I have a question kind of from everybody is where can you go to get the information to ask the questions of this group? We have the names and the organizations, but as far as, you know, an actual contact, email kind of contact or phone contact list. So I know you could go into the directory and probably find that, but I know that may be, you know, kind of the reason why they want to ask somebody in person, and you guys know that because I ask all the time. So, like,
Sure.
what's the best way to get to a person to ask your question about whatever? You know, I'm thinking about the network now has, what, 1,500 members or more? And it's impossible to know who all those members are. And, you know, the virtual roadmap is good, but it's not complete. So just to ask Grace a question about formatting or messaging or, you know, like give a little more info about that.
So as you mentioned, the network directory, which you can find from the home page, you can also find under members. So that will list all NOCT members. You can both play around with the Google directory feature that allows you to kind of toggle for the NOCT members, but we also have hyperlinked spreadsheets of all NOCT members, so you can look that way to find names. This presentation is also recorded and will be posted on Socius along with everybody's name and email address that's presenting today. And then other than that, a really quick and simple way that you can always ask a question, if you're on Socius at oralhealth.network, all the way right, there is a help tab. So you'll both find Socius demonstration videos that'll help walk you through any topic imaginable on Socius, including how to find network representatives. But you can also go to the support page and find all the different ways that your network support team can support you. And you can email us as a group and we'll filter your requests and get you in touch with whatever you need or whatever you're requesting. And so the email address to your network support team is openoralhealth@gmail.com. But I invite you to take a look at those pages as well to see all the great ways that you can get involved, what we have to offer, what we do as a network. And really, while I'm at it, just like all of the tabs are the most useful and commonly used items and materials. So both, you know, under the resources tab, you'll be able to see things that have been created by network members, mostly our NOCT working groups. But these are all resources for network members and the work that we do together. So take a look at those resources and then get involved in the discussion forums. So there's both network-wide forums and target forums. And you're able to subscribe to as many of these as you would like. You can customize your subscriptions. There's also guidance for that. But just play around because you can't damage anything on Socius. Nothing's irreversible. So get a little messy, invite others to jump in, but you know, it's as big as we make it and it's as, you know, useful as we want it to be. So make sure you're contributing as much as you're, you know, utilizing, and if you have any ideas for improvement or feedback, just go ahead and email your network support team. So that I'll get off my soapbox now. And
Francis, we got a couple of questions, other questions in the chat,
Okay.
and a comment.
Okay, so I see from Edward Cox, we stole the idea from Virginia about awarding mini grants to local groups to promote oral health access and education. This has increased the number of groups participating in our coalition. From Shannon Kaza, we contact tobacco cessation groups and LGBTQ advocates. Nice. So from Julie, can the business cards be customizable with organizational information? So that's a Grace question. And how can you get business cards? So they are in outreach materials. So you can see from Julie and the link that she provided, that's also under About Us, or it's under members and then about open materials. Everything in there is actually located in that practical guide resource. So the page that just visually displays every resource is included in that folder about open materials under the members tab. So for how you get business cards, those were included in the mid-year convening ditty bags. I forget what we were calling them. But those red open doors bags had some business cards in them. You can print them out because they're included in the practical guide. It would have to be at size, but you can print those cardstock. And as far as ordering, we've been discussing how reps would be able to order at cost. I don't know that we've finalized a process for that, but that's something that we're thinking through. If there's any of you that would like to request materials, it's not a definite, but we're thinking about how that might be able to be possible.
Yeah, and Francis, for the business card in particular is already set, camera ready. It has kind of crop marks and bleeds, so you guys could upload that to, if you use like a PS Print or other online vendor, that's an easy way to order some of those, and really inexpensive too, in the meantime, as we're figuring out the rest of our support around that. And then I see a couple questions about co-branding, and that's definitely on our radar. We'll have to kind of look at the materials and maybe think about creating them with space where you all could drop in your organizational information and contact information. So we haven't done that yet, but we're definitely moving in that direction.
Okay, so some other comments that we had. I will contact teledentistry experts and groups in California. Another comment, I have been following open on social media, and other groups are suggested. As I repost and share open messages, I am now following other groups. So that's great. And make sure also when you're on socials, there's a Facebook, Twitter, and YouTube icon that sits on top of the navigation bar, so you can access our social media channels through any of those. So please make sure you like and follow, share with us, tag us, and repost as often as you can. So I think we have time for a few more questions. It looks like there's nothing more in the chat box for now.
There's one more. There we go. Right.
So Jen, did you want to walk through the final slide? Jan? Okay.
Well,
I'll just, yeah.
go ahead, Francis. Yeah.
Sure. So for a few reminders, as you're engaging new stakeholders, just follow up with appreciation for their time, the opportunity for speaking with them, for their interest and attention, and be creative. And we are always down to brainstorm ideas. You can always email your network support team or any members of this group with some ideas if you want to be creative, get playful. This is definitely the right group to kind of spitball some ideas with. So if there's any answers that you don't have to questions raised, again, you can get in touch with your network support team, but you can really find a lot of these resources on Socius, as I mentioned. Make sure you link them back to information of interest. That's both the virtual roadmap for them to plot their programs or initiatives that are taking place. And that is, a pin drop that is across all 50 states, so you can see what people are working on and where. And then also share the SOCIAS demonstration videos so that when people are getting involved, they're able just from the very beginning to know how to navigate, because I know all of us have different experience level with SOCIAS, but it's getting easier every day to be able to click through and find what you need. And so please also schedule a next call or a meeting with these stakeholders, and make sure that you mention there will be a town hall if you are a state or a grassroots representative that's participating in the 2019 Open Wide project. So it's always good to schedule a next call or meeting, but also for our state and root reps, make sure to keep in mind who you're speaking to and track that for the town hall that we'll be having. And then finally, a periodic, how else can I support your engagement with Open? And just check back in with them or keep the relationship in mind as you're inviting stakeholders to new things or whatever you may be doing. So I think that might be all for the slides. But yeah, for just in closing, you can give any of us a call for support. If you have any further ideas that you want to kick around, we're happy to help. So again, this recording will be posted on SOCIAS in the Take 20 archive, and then we'll make sure to post that for state and grassroots representatives as well. And you can contact your network support team or any of these NOC team members for any questions, ideas, or assistance. So thank you all so much for joining us today, and happy knocking.